Welcome to Pilates for Scoliosis. I'm Rika Brixie, and I'm going to give you some information that I hope is going to help you in understanding the unique structure of your curvy spine. So, as you may or may not know, scoliosis is a three-dimensional curvature of the spine. It consists of both a side bend, a lateral shift, in combination with rotation of the affected vertebrae. So it's a bend in combination with a twist of the spine. Now, scoliosis can occur at any level of the spine. So we can see lumbar scoliosis, that's scoliosis in the lower region of the spine, in the lower back. You can also see thoracic scoliosis, which takes place in the mid-upper back, in the region where the rib cage lives. And then we can also see cervical scoliosis, which occurs in the neck. Scoliosis is usually diagnosed as either a C curvature, which is what I have in my body, or an S curvature. And whether you're a C curve or an S curve, each curvature is completely unique from any other. So we'll always need to treat each spine as an individual. What can sometimes be very confusing when you're diagnosed with scoliosis is the question of convexity. So when we talk about the convexity of the spine, it means the direction that the spine is pointing towards. So for example, here, if my spine is bending this way, the spine is pointing to the right, which means that I have a right convexity in that area. So it can be quite confusing when you're told the convexity of your spine to actually equate what that means in your own body. So a simple way that you can check is if you take your hands onto the side of your body. So we'll look at the rib cage first. And if you slide your hands down the side of your ribs, you may feel a little bit of rotation, but what we're looking at is the side to side range. So you're likely to feel that one side is more prominent than the other. And that would mean that that is your convexity in this region of the spine. Then you can continue running your hands down your body to the pelvis in the lower back. And again, here you're likely to feel that one hip or one side of the lower back is more prominent than the other, meaning that that would then be the convexity in that region of the spine. So what that means in my body is that in my lumbar spine, I have a convexity to the left, and in the thoracic spine, I have a convexity to the right. It can be overwhelming and hard to navigate being diagnosed with scoliosis, so I find it's really beneficial to have a deeper understanding of these quite basic terms. I hope that you find that helpful, and I hope you have a lovely day.